Today we're doing our 20th video. The last time we got together was about a month ago, and we had a much different experience going on through our healthcare system in our community. We were feeling optimistic that we had turned a corner on COVID, but today we are facing a different reality, and we want to talk about that. In the surge that we experienced last year, the top number that we had of our COVID inpatients was 130. Today we're at greater than 200 patients. It has gone up very quickly over the past 6 weeks, and we're still not sure where the top of that might be. We have many people who are very severely ill and are in our ICUs, and our ICUs are full. We are continuing to have to look for new ways to accommodate our ICU patients. So we're continuing to look in other areas of the hospital and turn what would normally be a med-surg bed into an ICU bed. Our team is working around the clock to make sure we have enough ventilators, protective equipment, and other safety supplies here to be able to treat our patients on a daily basis. We want to make sure that we can meet the needs at any given time for those who present themselves. Over 90% of our patients that are being admitted to the hospital are unvaccinated, and those going to the ICU are even more. We are seeing patients of all ages this time. The youngest I've seen so far is a 22-day-old patient. We have seen patients as old as in their 80s, but there are a lot of patients that are hospitalized here and very sick here that are in their 20s, 30s, 40s, and 50s. Unfortunately, we're seeing the pace of death pick up as well. In July, we had 4 COVID patients pass away. In August, we've had over 20 patients to date, and these range in ages from 30s to the 80s. This is taking a huge toll on our staff. It's heartbreaking for them every time they have a patient come in, and then when they have a patient die, it just devastates them. Everyone here is working long hours, extra shifts, and everyone here is tired, but completely dedicated to the safety and well-being of our community and our patients. We know that staff can't just turn this off when they go home. We know it's incredibly stressful for them when they get home and we're dealing with their loved ones. We just can't thank them enough for everything that they continue to do. Each day I receive phone calls and emails from the members of the community asking, what can we do for your staff to show our appreciation? And while we have a number of different programs they can participate in, the biggest thing anyone can do is wear a mask, stay socially distanced, and get the vaccine. We continue to look for new and innovative ways to deliver care for our patients and have our staff come together. One of those was a couple of days ago, we put out a call for helping hands. We didn't really know what to expect, but we were inundated with people who wanted to come together and help out our care teams. It just tells you one more time how much our employees care about what goes on here with our patients and our other staff members. We're continuously looking for new nurses, whether it's contract or permanent employment, to come in and help our team. We have had to start looking at postponing surgeries. So in collaboration with our chief of surgery and our chief medical officer, we started looking at what are the most emergent cases and what could be put off until our census goes down a bit. I would just thank all the surgeons who have come together and really helped us with this process and have really pitched in to make the right decisions. Our physicians continue to step up on a day-to-day basis. As this surge has happened, we've reached out to many of the different specialties and asked what they can do to help in the process, and each and every one of them has stepped up and helped in a very meaningful way. We cannot thank you enough. Ever since COVID first appeared in our community back in March of 2020, our staff has stepped up for this community and served this community and our patients with incredible dedication. That has not wavered over this past year and a half. Whatever crisis comes our way, our staff always steps up and does whatever it takes to put patients in our community first. As I've watched our staff over the past 18 months, I've just been incredibly impressed with everything that you do on a day in and day out basis and how we continue to put our patients and our community first. I'm speaking not only from myself, but from our board of directors and from our other senior managers. And I will tell you, I'm speaking on behalf of the community who thank you for this each and every day as well. Each day I'm asked, when do we think this surge is going to end? When do we think this pandemic is going to end? There are a lot of pundits out there that are trying to do predictions around this. I'm going to tell you the honest truth is I don't know. We've seen lots of ups and downs in this pandemic since it started back in March of 2020. I'm hopeful that we're getting towards the end of this. I'm certainly hopeful that our numbers start to go down. But I do know that whatever we do, it will be from always putting the patient and the community first, and we will always do our best each and every day. To our community, please stay safe and be healthy. Please take the vaccine, stay masked, and keep social distance. Thank you.